I remember looking at Kath going, I just don't know if I'm ever going to feel good again. I just want to feel good again, you know. We've been together close to forever. I can't imagine being without my soulmate, my partner in life, and my wife. Kathy and I decided to have children at an older age, and so we adopted 2 kids. That just was really at the forefront of my thinking. I didn't want to leave them. They were 11 and 13 at the time, and I wanted to be an active mom as I had been, whether it's Ashley and her fashion sewing activities or Justin with his baseball and volleyball, and just being part of their lives and watching them grow up.
She came home one evening after a doctor's appointment and broke it to me that she was diagnosed with bladder cancer. You realize that cancer had forced its way into our life and was hugely unexpected.
From the get-go, Dr. Scherr was it. I know for me, and I think for Kathy as well. And I think the one deciding thing was his empathy.
He also spoke about a team of experts that meet weekly and how Hope's diagnosis and the tumor that we were treating would be a part of that conversation. It wasn't just Dr. Scherr in that meeting, it was the oncologist who ended up becoming Dr. Nanus, another favorite of ours. But it just gave you the confidence and comfort that this was a Cornell team effort.
Hope was diagnosed with an invasive higher stage tumor. So in that setting, we elected to surgically remove her bladder, and she went through one of the urinary diversions where we create a new bladder out of her intestine, and that's called a continent cutaneous urinary diversion, or sometimes referred to as an Indiana pouch. One of the biggest things that Hope benefited from, that we're real leaders here at NewYork-Presbyterian Weill at Cornell, is our precision medicine program.
We decided to take her tumor and sequence it, and it showed a number of genetic alterations, and some of them suggested that she might be a candidate for immunotherapy. So immunotherapy for bladder cancer, like other types of cancer, is a way where you stimulate your own immune system. And now, much later, she's doing unbelievably well. She continues on immunotherapy. She comes in and sees me every 3 weeks. She's back to living a normal life, and we all couldn't be happier.
Right now, today, looking back, I think it has made our family stronger.
It just causes you to be grateful for those moments of happiness, those moments that we're together, be it going for a walk or a bike ride, that we don't take those things for granted anymore. And the kids share that enthusiasm for where we are today, too.
Knowing that Kathleen was doing the research, making sure that things were organized, it took all of that off of me, where I could just focus on, what does this mean? What are the implications? What's my role in healing? I could not have survived without that support. As a patient, you have to have a positive attitude or you're defeated before you go in. And to realize that, yes, I can work out, I can play golf, and I feel good. Hopefully, I will continue being active and living life.
There's a reason her name is Hope.
I've learned as much from Hope, hopefully, as she learned from us. In that, I really have gotten to know her family, her children. Having a support structure like Hope has had, both in Kathy and her children, I think has been incredibly important to getting her to where she is today.
I know Dr. Scherr saved my life twice. Twice on the operating table. And I wouldn't have wanted anyone else but him to be there. And Dr. Nanus, he's been there every step of the way. He came to the hospital when I was going through surgery to check in, to visit. How are you feeling? How are you doing? We're not stopping. We're not giving up. They were there every single step.